Well, hello everyone. Glad you could join us tonight. And tonight we have a special guest, Margarita, who I'll explain later. But she comes with fabulous knowledge on massage therapy and the lymphatic system, and I think you're going to very much enjoy tonight. So at this point, I want to introduce Marguerite. Margarita Martinez is a medical esthetician and lymphatic specialist. Margarita is a passionate and skilled medical esthetician at Sapphire Spa with specialized expertise in Brazilian lymphatic drainage massage. Having personally experienced the transformative benefits of lymphatic therapies during her own recovery journey, she made it her mission to bring that concentrated healing to her clients. So go to SapphireMassage.ca. Her approach combines medical grade techniques with compassionate care. Each session begins with a thorough consultation to understand your wellness history and goals. Then she guides you through gentle rhythmic techniques and focusing on the big 6 lymph node activation points to enhance detoxification, reduce fluid retention, and boost overall vitality. So when you're in Margarita's hands, you're not just receiving a treatment, you're embarking on nurturing, healthy journey. She continually educates herself on the latest wellness trends and stays committed to offering treatments that promote long-term health and balance. And she has been able to integrate our mini canopy that you see over here into her practice, and she uses it as well, and she'll get into that. But now what we're going to do is go into a short video, and then we'll go from there. 15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your finger, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs. All right, now we're going to introduce our guest, Margarita. And Margarita, would you like to come on with your video? There we go. How you doing this evening?
You?
Good, good. How about yourself?
I'm good. Thank you so much. Thank you for having me.
That's great. That's great. So tell me, first of all, how did we meet?
That is very very meaningful. I think like the way that we encountered each other. This goes back to my practice on trying to offer my clients the best way to heal. And I was focusing into post-op treatments, and I needed LED. And I was doing like a research about LEDs, and I didn't see nothing that convinced me. And one day, Winston stopped by the property.
Right. Winston is one of our associates that works with us here. Yeah.
And he just came and started talking to me about the product. And myself, I was just laughing because I like, here I am myself online looking for an LED. And here it is. God has just sent this angel over here to come and talk to me about a product. So we were talking for a couple of weeks, and still not convinced. And just happens to be that one day, a Saturday, I have a full schedule. And I woke up with a sore tooth. And it was like so bad. Like when I woke up, I even have like my side of the cheek was so swollen. And I'm calling different dentists that they take emergency. Everyone is booked. And then I remember Winston, and he told me about that this LED treats sore tooth. And I called him, and he said, sure. And he wasn't around, but he sent you. And you guys lend me the poem, that baby, exactly. And you told me to do like I think like 3 sessions, 5 minutes, but I was about that. My first appointment is coming, so I think that I did only like 3 minutes before I have to go in a session. And I was surprised that through the session with my client, I start to feel like the pain is going away. So I didn't get a chance to do another treatment until about maybe before I did the first treatment was sometime before 9 o'clock. And then by the time that I get a chance to do a second treatment was about 3 o'clock. And I just couldn't believe when I go see myself in the mirror, the swelling has gone down like a big time. And I was like, wow. And that was it for me. Like, I have to have this product to bring to my clients.
Right, right. And then you start using it on your hands as well, right?
Yeah, I start to use that on my hands. Most of the massage therapists, they probably identify themselves with this. It's like, sometimes it's like at the end of the day or towards end of the week, our hands get like a swollen and sore.
Yeah, you're doing so much work with your hands. It's got to be hard on the hands.
It is. So before I even had the product, at the end of the day, I had to massage my own hand. Like I go with my forearm and with my elbow, I go between my fingers to make sure that I'm getting all this tissue relaxed, which is quite painful. So then when we got the products, I start using on my hands, and it's like just amazing. Now, every week, towards to the end of our week, what I do is I lay down, put my hands on my chest, and it's like a miracle. I think next week I'm ready to go.
Yeah, it's something how it can help, get the mobility back in the hands and reduce some of the swelling that takes place just from whatever it is that people do, whether they're carpenters or whether they're on their knees a lot or whatever, they, having knee pain, they can help reduce it by using the light on their different parts. Now, you also, I was really having a hard time because I did something and then I was in a lot of pain. But what you did is you had gotten one of the mini canopies here, and what you found was when you used it on me, that you could actually get better into the areas, right? That's what you found with because it helps loosen up the muscles. Maybe you want to explain a little bit about that.
Correct. Yeah. So what happened with the tissue, right? Is that most of the time it gets like a swollen. Sometimes it's overuse of repetitive move. And when when there is a swollen, it is really hard to work the tissue. Before myself, I used to use like a lot of, like on my knuckles, or I used like on my forearms or elbow. But this time, because I'm still like experimenting, let me see what else I can achieve with this product. So that's one of the things, the one that we're doing. Who best to try the product than the person that is creating it? And I was just amazed, like, to see that I didn't have to try to go and break the tissue too much. And most of the massage therapists, they will, understand that's the reason why some of them they use the cupping, so then they can break the tissue, so they can go and do this deep tissue work. And they use differently. Some people they use the scraping to get through that, but me, I was like so amazed and impressed and grateful. And I've been using the same treatment or technique in most of my clients since then, and it works like a miracle. I get to see maybe somebody that is in a lot of pain, and the muscles are really, 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 really tight. Before, we have to do about 6 treatments to
Right.
get the person somehow in a good place. Now I can tell you, like, very proud and guarantee that after 3 treatments, client is like almost 100%.
Yeah.
And we don't get to see this client after for 6 months, because that's how well it gets.
But then they tell 6 more clients that how well it worked out for them, and that's been neat. You've been able to use it as well for lymphatic. Tell us more about the lymphatic system and how important that is in the body.
The lymphatic system. When we talk about lymphatic system, we are talking about immune system. One of the primary function is that the lymphatic system is in charge to remove everything and anything that is trying to kill you. When we said trying to kill you, we're talking about viruses, bacteria, parasites, fungus. Over time, the lymphatic system gets blocked. We have about 700 lymphatic nodes, but when we work with the main ones, which that's why we refer to the big 6, which is neck, clavicle, abdomen, underarms, inguinal, and behind the knee. Those areas are the drainage, and they get blocked for many reasons. Could be somebody that's been ill. Nowadays, it's very common because we tend to sit a lot. When I'm sitting myself, I'm blocking the ones on the knee, the crescent. When I slouch like that, I'm blocking one of the main ones, which is the one in the abdomen. So how this has been helping me, LED, has been like life-changing for a lot of people, because one of the things about the lymphatic system when it gets blocked is a lot of inflammation. And the inflammation most of the time is in the abdomen. In the abdomen, we have layers and layers of lymphatic nodes. But if I had to work myself like manually, I can still do the drainage, but I cannot activate the layers and layers and layers that are in the abdomen. With the LED, it's one of the things that I get to achieve is to activate all these layers of lymphatics and bring down that swelling. That I can tell you, very proud that one session, the client get to see the benefits. And most of the clients, they get like amazed that, okay, we didn't use any medication, no magic pill, no injections. It's just the lymphatic drainage, activating the drainage, and using the LEDs. And it's just amazing. When it comes down to pain, it is just amazing because we'll understand that where there is a pain is inflammation. That's what we translate. Anywhere that you're experiencing pain, there is inflammation. Also, with my cancer recovery clients, we have like amazing results, post-op, amazing results. We get people that they're going through liposuction, and that is like a lot of trauma. It doesn't matter what part of the body it gets like liposuction. It's a lot of trauma, and they get like so amazed that 2 sessions. Normally we do like 10 sessions of massage for this kind of client.
Right.
And they get amazed like 2 sessions. Inflammation, bruising is almost gone.
Bruising, yeah, and bruising is something that does happen right away
Because of the trauma.
Yeah.
Yeah.
And so with the light and your work, it helps reduce that. You also showed me some pictures of people, like in particular, how much their leg diameter changed just in, I think it was one treatment, wasn't it? That the one of the pictures you sent me, how much reduction of inflammation when you had treated that leg and you had done the massage and the lymphatic drainage and the LED all tied together. That you showed me some pictures, right?
Yeah, it's amazing because like one of these clients, she said that she has gone through different places to look for help, and nothing was helping. And she heard about lymphatic drainage. Like sometimes people is so desperate. They are like tired of being in pain or dealing with the same health issue that they are so desperate. They go like, I just gonna go anywhere and help me. So she was her daughter, the one that heard about lymphatic drainage, and she made the appointment. She came and see me, and she's one of my clients. All of them, they get my heart, but she just got my heart because when she came to the front, she's like crying because before she couldn't even put her sandal. Now her sandal is like loose and she's just crying. And she's like, what did you do? I said, I didn't do nothing. We just did a red light therapy and we drained your leg. And that's what happened. And she was like crying. She was just crying because she was so grateful. She's gone through different places to look for help. Nothing was helping. But it's like, understanding the lymphatic system. I always tell people, good health starts with the lymphatic system that is draining because he's in charge of taking away everything, any waste that doesn't help the body anymore. And all your health problems start with the lymphatic system that is blocked.
Mm-hmm. And even we have the helmet, this device here that you're familiar with. So there is a lymphatic system within the brain too, and this is called the glymphatic system. And we have been able to help with reduction of inflammation in the brain, which is I was not aware of it as to how many different types of problems, like even strokes, concussions, Parkinson's, dementia, all these even autism. There's inflammation on the brain. So with the light therapy that you're using, we can help reduce the inflammation on the brain. As soon as that happens, the brain can start working better. And
that's the thing, Tom. It's like the lymphatic system, like I said, by itself can help the body to heal. Okay, but one of the main problems or issues in there always is gonna be inflammation. Okay, so I think myself that if I didn't have a red light therapy, I wouldn't be able to move that inflammation, which is the reason why our clients, the very first session, people go there with pain, And then they come out and they're like, what did you do? I was like, we just activate your lymphatic system, red light therapy, reduce the inflammation, and that's the result. We have like a people suffering like migraines for many years and taking like medication, and they get tired of taking this medication. But when they come, we do the consultation. Then we explain to them that this is like an inflammation in the brain, and like you mentioned, we have our lymphatics, and we need to activate. The other way that we treat people here in house is like we don't isolate part of the body, understanding that the body is a unit, is a
Hmm.
whole, and no system of the body gets injured alone. Everything is connected. So
Yep.
when they come into property, that's what we do. This like we activate and we do a full body lymphatic drainage. People, the ones suffering from chronic sinus, many years. They have. I was one of them myself. Sometimes you are on antibiotics, seeing like a natural path, nothing seems to help. Red light therapy or SunPower LED and lymphatic drainage is like open up the sinus like right away. People, it's like inflammation is coming down. All this mucus is coming out the next day.
Yeah, that's
Amazing.
it is. It is. It's really something. And I really think that it's beautiful. I get to be close enough to be able to get your treatments, and it's been really, really good. For those that are anywhere from Hamilton to St. Catharines or some Burlington, gotta check out Sapphire Spa and connect with Margarita. She's got an excellent practice and very, very good. But she's been using working with us with the SunPowerLED and seeing some great stuff happening. So it's so neat to be able to have you on. And I know that there's going to be some questions coming up. So those that have questions, please start adding questions to our chat line here, and we'll try and answer some of those questions. But Marguerite, what other things have you noticed with the light? Any other areas on the body? I mean, you've explained quite a bit of how you're utilizing anything else comes to mind?
Well, I've been using also the light to treat, like I said, some of my cancer recovered clients, and amazing results. When we're talking about like breast cancer, one of the first things that they get removed is the lymphatics, the underarm.
Right.
And because they get removed, so this kind of clients, they tend to retain a lot of fluids around their arms. And this is very painful. To carry that fluid is very painful. I had a client also that she started to retain a fluid around the incision. And it was like really bad when she came see me, almost the size of eggplant, and almost looked like an eggplant because it was like a purple like that and full of fluid. The same thing. She's like, you think that you can help? I said, we can always like try, because when people is suffering already, you don't want to promise people and put this full hopes, right? And she was like very impressed, and myself, I was like very grateful, especially with this kind of client. Grateful to God, grateful to your product, that we were able to move this fluid out of her body.
Mm.
And once again, a lot of this happens first session. Sometimes it takes like 2 sessions. We normally recommend people to do about start with 4 sessions, because depends. Some people come also to see us because they have IBS problems or a digestion problem. When we're talking about this, we're talking a lot of gut inflammation. So at least we recommend 4 sessions.
Mhm.
This stagnation didn't happen overnight. It's like a buildup of several years. So it's going to take some time to get this plumbing
Yep.
system running properly again. and a lot of successful stories.
Yeah, that's beautiful. Well, Margarita, I'm just going to ask you for a moment there. We're going to go off to a video, and then we'll come back on and we'll go into the questions. I'll actually talk a little bit more about the product and bring you back in for the questions that we've got coming in here. So, okay, be right back with you again in a few minutes.
Okay.
PBM stands for Photobiomodulation. Photo being light, bio being biology, and light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's the sun, but that light comes through the skin layers, and actually the cells are able to absorb that light, converting it to energy, and then there's a host of different processes that are stimulated because of that light. So you can speed up healing, you can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPowerLED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have two different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter, and that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPowerLED Palm series, can help you, please reach out to us and we'll get back to you as soon as we can. Okay, so the only update to that particular video is that we do have the Super Palm 1050 now, the wavelength that has 660 nanometer wavelength and the totally invisible wavelength of 1050 nanometer. I can't see this to my eye at all, but that's the 1050 nanometer. So we have 660 nanometer, which is the bright red. And bright red does not have the ability to penetrate super deep. It gets absorbed highly by the blood, and then the blood can, and that's great because the blood, the cells can absorb that wavelength and feed the mitochondria with energy. even in the blood, and then the blood goes much further than the area that you're treating. And then when you switch it over to, let's say, the 10 nanometer, as you can see here, this one here is the 10 nanometer. I can see this a little bit. The 810 will penetrate much, much deeper into the flesh, into the body, and be able to reach hip joints and even into the brain. When people use it for various challenges like tinnitus, ringing in the ears, vertigo, it's possible to do like 1 minute of the red wavelength and 3 minutes of the near infrared wavelength with this. And then you can use this as well, these palm lights anywhere on the body with different lengths of time. The deeper, general rule of thumb, the deeper you're trying to get into the body, the deeper you're trying to go, the more time that you want to spend with it so that you can get a certain amount of energy at that depth. So if you were treating, let's say, your hands, you might look at 1 to 2 minutes of the bright red and 2 to 3 minutes of the near infrared. If you're now trying to work on something deeper like a shoulder, you're going to have to spend a lot more time with that. So maybe that's in the area of 5 minutes of the red and another 10 or 15 minutes of the near infrared. It's not super critical. The times that we give you are ones to work with to start, so that I know you can see some results. If it like quicker, it's possible that you could do a very short treatment and already get results. Like we've had people even a couple minutes with when they've had tooth extractions, wisdom teeth removal, that in just a couple minutes they can reduce the pain and inflammation by using the 2 wavelengths on their cheek like this, on jaw or wherever they're trying to treat. It's really and it's not harmful if you spend more time. Generally, though, around the face and the eyes, if someone was to use it for your eyes, you would spend like with the eyelids closed, you would be doing 1 minute of the bright red. If you do find it a little too bright for yourself, you can always pull it back a little bit, but 1 minute of the bright red and 1 minute of the near infrared on each eye with the eyelids closed. And when the eyelids are closed, what's going to happen is it's going to diffuse the light. So as the light goes in, it's very diffused and there's no hot spots on the eye. This is an example here of the light, how even the illumination is. You can see it's very even across that whole surface. Now, I'm not putting it perfectly flat on here. That's why it doesn't, but what you can see is that there's no spots of light like some of the other devices that you get where there's just some hot spots of light, and it really isn't like a device like this where when you put it on there, here you get a polka dot effect. So really all this area in between, as you can see, that there's not much coming through here, all this area, whereas ours is just continuous across the whole area. So when you're trying to treat some part on your body, it's just not a few spots of light coming down. It's actually a very even high amount of light energy. We also have, for our devices, we have the oral probe. The oral probe is a device that goes onto the light, and what that allows you to do is you can select which wavelength you want to use. You put it into the hole that is for that wavelength, and now what you can do is you can see that this puts a lot of light wherever you're trying to put that light in your mouth on certain areas. If you want to have a concentrated amount of light on a specific spot, so you can do the 660 nanometer or the 810 nanometer. So that's the oral probe that we have on our devices, on our website as well. Now, the light has the potential easily to go into the brain. And so we do have the helmet here, and we've had all sorts of good results with all kinds of conditions where, as I mentioned before, inflammation on the brain, that we have a full stand that this, you just go under it like that, pull it down, and turn on the wavelength that you're going to use. And in this case, it'd be 1 minute of the red, the bright red, and 3 minutes of the near infrared, which is the other wavelength that you see coming out of this device here right now. It's hard to see, but the 810 nanometer is there. And that this unit that we've designed all has our proprietary technology of the cooling. There's 10 of these palm lights all the way around the helm, all the way around the skull, to give you a high amount of light, nice and even across the whole skull. And that's how we've been able to see some significant improvements in people's lives with that. We with all kinds of cognitive issues. We also have the mini canopy. This device has a stand as well, so you can move it up and down. You can turn it flat so you can lay down. And it has the red wavelength, 660, and it has the 810 nanometer wavelength, which you can kind of see there. Not very well. Okay, new camera. It's much harder. We got a little better camera here now, and you can't pick up the near infrared, but there's near infrared coming out of that on the other wavelength. No, it's fine. No, that's okay. That's okay. Anyways, that's just you can see that a lot easier when you take a cell phone, and it has to be an Android phone. And if you put it in camera mode, we have the wavelength as well. This has a 660 810. We also have a device that has the 660 nanometer, and the other wavelength is 1050. So if we look at this here right now, it's not on right now, so you can't see much. But since this is okay, there's your bright red. You can see that, no problem. But here's the near infrared. Oh, wow. So it's really, really difficult to try and show that now. But that's okay. It's just yeah. Anyways, so there's a lot of optical power, and what we've done then is on this mini canopy is, instead of having a very, very large canopy, like this, and it's got these points of light, a few pieces of light here and there, you'd have to squeeze one of those things way, way down to get the optical power density that we have. And that's why we can use this for treatment on the body, on shoulders and backs, and even this unit has been used for around the brain as well. So like in three places, like that, and then around the other side and from the top. So even if you wanted a more multi-purpose, the mini canopy can help you there, instead of going with if you're trying to treat other parts of the body, you can use the helmet. Now, if you are really, really needing the helmet, people have used, they put their foot in the helmet. They put it down low. They put their foot or their hand or their knee or their elbow. It's another way of using the helmet for other parts of treatment on their body. So we do have those different devices. There's lots of information on the research page. By the way, I meant to say earlier, I really appreciate if you would visit our SunPowerLED YouTube channel and subscribe. It's very, very helpful for you to subscribe, because one thing it'll do for you is you'll be able to know when we repost a vid like our webinar, or other times we have unique interviews and you'll be the first ones to know when we've got those new ones up. So go to SunPowerLED.com, and if you watch one of the webinars and you like it, please hit the like button for us, because that helps others to know about our light too. So now I'm going to get Margarita to come back on, and we're going to start looking at some of these questions. So here we go. Okay, first question here. Okay, Ed is asking, I have recently had an ACL operation. Can you please explain how the palm device might be used for the rehab program? So one thing, Ed, is that with ACLs is that you can use the light around the area, and I'll just mention, if you're using the light after, that's fine too. You'll have great results. But if anybody's planning on going in for an operation, ideally, if they put the palm light on the areas and pre-treat the areas, it helps with the trauma that the body's going to take in when the surgery is done. So if you can help with that, if you can treat beforehand, but after, I would treat if as 3 times a day, 4 times a day, even on a recent operation. You can help get the more range of motion happening. I would spend about 2/3 to 3/4 of your time on the near infrared, because the near infrared will penetrate the depth, but you still want to add to it the red. So if you got a half an hour's time, use it around that ACL where the operation took place. And if you can do that, if you don't have the time, if you only got half the time, use it half as much. It's still going to have a significant improvement on that. Okay, so Michael is asking, is your hand injury more OA and lactic acid? Okay, I guess this is a good question for you. Is your hand injury more of an osteoarthritis and lactic acid buildup? What do you think? They're asking this question. Have you had a patient with nerve damage in both lumbrical? Whoa, these are hard terms for me to pronounce. Intertossi-dorsal and areas. Those would be the lower back, I believe. Dorsal, yeah. Okay, first we'll ask the first question. Is your hand, why do you figure your hands get sore? Do you think it's a lactic acid buildup, Margarita? Or do you?
Well, it depends, because if we're talking about lactic acid, is this person is like active? Normally, the one that they build up a lot of lactic acid is like athletes, because like the range motion, heavy lifting, for instance, boxers, because all this jabbing, the one that they do, they build, right? But if I'm getting this numbness on my hands, that could be like a inflammation and neurological.
Mm-hmm.
More
Okay.
than, unless that, like I said, but we will have to know more information. Like
yeah, it's pretty hard.
Has to do with athletes most of the time, or maybe a construction worker, because like if you're like a painter and your hands are constantly up, so that could be. But we need to know more detail about what is
right.
the
And
person is.
I can there was a question about Baker's cyst. We've been able to see Baker's cyst do very, very well with the light therapy. Tremendous improvement in getting rid of reducing or totally getting rid of Baker's cysts. So okay. Budowin is asking, let's see, how how can you notice lymphatic drainage from your body, and what's the protocol? Where do I aim the light, and how does it combine with massage? So how can you notice the lymphatic that there's a difference with the lymphatic drainage? My thing would be you'd see it this the size, the diameter, like the area would reduce, right? Is that what you would like in puffiness? Is that what you'd see if the lymphatic drainage is doing better?
Yeah, like mostly in most of the cases, depends who you're treating, and what condition you're treating. You get to see, like, if you're treating somebody that is having like a lot of problems with the abdomen, you'll see like the inflammation goes like down. Like, honestly, I can tell you myself, if we're talking about the abdomen, we can remove from 2 to 8 pounds of just fluid using lymphatic drainage in combination to the red light therapy.
Mm-hmm. 2 to 8 pounds.
Two
Wow.
to eight pounds, and that you can see. Like unfortunately, I don't have pictures to show right now because I have it on my cell phone, so it'd be so hard to show it on
Yes. Yeah.
camera right now. But like you can see, like right away, I have recently, I have a client that he came to see me once again, problem with the tooth, and he went to see doctor, dentist, nothing seems to help. They recommend him like a lymphatic drainage. He came to see us, and he left, and he couldn't believe that he was able to open and close his mouth. He said that even he has some sores inside, and they were very painful. Did a follow up in a couple of days. He was doing like well. When it comes to arthritis, also, you can see like a pain reduction going like one session, and the inflammation. Because I always tell my clients, when we talk about inflammation, my language, pain in my language is translate to inflammation. And we must treat the inflammation before we treat anything else. But to me, it's like the perfect marriage right now when it comes down to wellness. If you are serious about wellness and helping your clients, is SunPowerLED and lymphatic drainage massage. But when we talk about lymphatic drainage massage, let me just clarify that the technique I use myself is a Brazilian. So it's a Brazilian lymphatic drainage massage, which when you do the strokes, is more precise. Back in the days, we used to use like a bottler, which is like a very gentle movements. We understand that our diets have changed a lot. The density of the fluid is more, so we need to put like a more precise strokes. But keep in mind that when we talk about precise stroke, that doesn't mean that I'm going like a really, like almost like a massage. No, it still is that gentle, but the strokes are more precise to bring all this fluid right to the drainage, which that's the reason why we get to see, or at least in my practice, we get to see like almost immediate results.
Mm-hmm. Thank you. Thank you. Greg is asking, is there a reason that red light is always used before NIR? Can you go straight to the NIR? I will say that with the near infrared light, I always do like, I've talked to many people about this. We like the red light because it really stimulates the blood flow as well. It's more of that happening. So why not get the blood flowing first and then go to the NIR? If you're crunched on time, you might want to just go to the NIR, but I'd always, if you have that opportunity, I'd always like to add that to the mix. Okay, so here's another question from Phyllis. Thank you, Phyllis, for your question here. I have a torn meniscus. How can I drain the knee lymph, and how much time do I need to spend on the red light? So from what I understand, what I've seen is that the treatment of the back of the knee is extremely important. for lymphatic drainage with the light therapy as part of the equation. Yes, you can treat around the knee, but the back of the knee, also the groin area is very helpful. And would you, Margarita, can you add to that a little bit, because this is a little different area than I'm used to, but go for it.
Yeah, for that, you could treat with the lymphatic, but keep in mind that when I said that no part of the body injured alone. So when we treat, you have to treat the whole body, because although is behind the knee and you need to stimulate and open up that lymphatic node, keep in mind that the fluid bottom of the feet, and that's gonna go and drain on the knee. If that is like a block, it's not gonna, the fluid is not gonna come and drain in the inguinal area. And
Right.
that fluid has to come and drain in your other node, the one that you have in your abdomen. And all these fluids, 75% of them, they come and drain in your left clavicle. So although you have the injury in your knee, that doesn't mean that you just have to treat that area. No, because this fluid has to come and drain in your left clavicle. And then it gets like reused by the body.
Okay, thank you. Thank you very much.
You're welcome.
Joe is asking, does Margarita's work with persons having migraines, could you or she explain a little more about how PBM can help with migraines? So migraines have multiple triggers on the that we've seen. Sometimes it can be in the neck area, and so I recommend, like, people should, until they know where the trigger point is, let's say on the migraine, they need, for what we've seen with just red light therapy, is just to treat the entire, neck and up through the base of the top part of the spine here, and up the base of the brain, and also the temples, the forehead, and sometimes it's even it's here on either side. So any one of those areas could be the trigger point. Later on, you may learn that if my problem comes from here. And so you can help starting by there, and it may be other areas. But Margarita, have you been able to see any other particular, I mean, you're also adding your physical strength to help loosen and get things moving, so that, but we've seen, I'll just mention, we were at a show in Florida, and two people came, two women, independently of each other, both had migraines. They did, under the helmet, they did 1 minute of red and 3 minutes of near infrared, and it almost totally eliminated their migraine. And then they did another round of 1 minute and 3 minutes, and it was gone. And that was for both patients, both people that came through the show. So it's possible that the light can just do it on its own. But what about yourself? What have you added to that? Anything in particular for migraines?
Pretty much the same protocol. But before, when we're dealing with migraines, I will always do like a little bit of palpitation. So I will palpate the nodes, the one that you have behind the ear. They shouldn't hurt, but if they do hurt, so that goes there to tell us that there is a lot of inflammation, especially your lymphatics. So we need to open up then. We need to do like a full body drainage, because once again, when we're talking about lymphatic system, it's a system that works together with circulatory system, nerve system. So it's a whole bunch of friends over there like are working together. So we have to make sure that we stimulate everything and do that drainage. But pretty much should be the same protocol.
Okay.
But starting with palpation and make sure which, because we have to figure out which lymphatic nodes are the ones that are very blocked, stimulate them, and treat with a red light therapy, and do the drainage.
Yeah, excellent, excellent. So Gladys is, do you start from the foot and go up, or from the hip and go down with lymphedema in the legs? So where do you start with your lymphatic drainage for legs?
See, although we seen like the legs, but there is like a specific protocol, the one that we have to follow. So once again, all the fluids, although they are in the feet, they are gonna try to rush and come and drain in your clavicle. Therefore, there is a sequence. Before I even treat the foot, which is the one that it has the lymphedema, I had to start treating your arms first, because these fluids are gonna come and drain in your clavicle. Then I'm gonna move into the leg, because in there I have other drainage, which is the one that is like behind the knee and the crescent area. And then those fluids are going to start coming there, but I cannot start treating the foot. I have to start treating your arm.
Start up higher where it's leaving first, get those areas going, then move down towards where the most swelling is, the lymph, right? Yeah, okay.
Correct.
Thank you for that. Thank you very much.
Because remember that where you have a lymphedema, where there is a lymphedema problem, already that area of the lymphatic system is damaged.
Mm-hmm. Okay, thank you. Gary, you're asking me, can you use this over the heart from the front or the back? Definitely. Well, I think from the front is the area that you want to be able to treat. No harm adding a little bit from the back, but there's a really neat guy called okay. Oh, that's interesting, Gary. Okay, so first of all, there's no problems treating the heart. We even feel that we're going to try and get some studies going where for people with probably problems with pericarditis or myocarditis, where you can help reduce the inflammation on the heart. Okay, another thing is Gary was asking, so he asked his doctor about this, and the doctor said that sometimes swollen feet can be due to heart problems, not lymphedema. Okay, well, thank you, Gary, for sharing that. Okay. Question from Tracy about varicose veins. That's a difficult one. I have not. I think if over long periods of time with treatment, I think it's possible to make a change. But varicose veins are a very difficult thing to treat that I'm aware of. Yeah, and I think. That's good. Phyllis is asking, okay, because we got people from all over the world tuned in, and they're wondering, how would you say you could find somebody who's a good lymphatic massage specialist? How can they find one if they're not in our area here?
See, I will set myself that if you are and I'm not trying to say anything, anyone, and I know I don't want to offend anyone, but if you're a professional lymphatic drainage specialist, you should be able to offer a consultation. When the client comes for a consultation, you get a sense whether the person has knowledge, because that's the opportunity you have to ask that question. And I believe myself that would be the best way to have like a better judgment if there is a good lymphatic drainage specialist.
Okay, well, thank you very much, Margarita. There's another commitment I have, so I have to run, but I want to thank you so much. I know there's still some questions that have come in. We haven't been able to answer them all. I'm sorry about that. But if you want to send your question in to info@SunPowerLED, that's info@SunPowerLED, and we'll try and answer the questions. And I want to thank everyone for joining us tonight. Thank you, Margarita, for coming on, taking your time to share a little bit of the knowledge that you have and the successes that you've had combining lymphatic drainage with massage and light therapy. So thank you, Margarita. And I've got other people that are writing in saying thank you, thank you, thank you. So thank you very much
for having me. Thank you for giving me the opportunity to express some of the knowledge, some of my experiences. And I thank you so much. And thank you everyone that was like watching us and the ones that asked the questions. And send the questions to Tone. I'll be happy myself to answer as many as I can. As Brazilian Lymphatic Drainage Massage, that is my passionate. I'm here to help the community and to help anyone that I can pass some of my knowledge.
Thank you. Thank you very much. And the riches of God's blessing on your practice that you have, as well as to all those listeners tonight. And remember, go to SunPowerLED, not only our main website, go there for the to go in for the draw, and also the competition, and then also go to SunPowerLED, the YouTube channel, and please subscribe and like our channel if you find that we've like the if you see a video that you really like, because that'll help us get this information out further. So we will have this video up within a week on our on your YouTube channel and probably our website as well. So all the best, and thank you everyone for joining us tonight. Bye for now.
Bye for now.